all my friends and my colleagues and my fans everywhere. This is Professor Dr. Tarek Ali speaking. Today I will speak about an important topic from the medical point of view and from the clinical point of view, and it is a clinically relevant issue, which is what is the difference between cataplexy and sleep paralysis and catatonia. What are the differences between cataplexy, sleep paralysis, and catatonia? What are the similarities and what are the differences? The three conditions are neurological conditions, that is, conditions which are related to some disturbance in the nervous system, or they are neurological problems which are commonly met with in clinical practice. The three conditions, or the three medical conditions, the cataplexy, the sleep paralysis, and the catatonia, they are all conditions characterized by loss of voluntary muscle control and movement, causing some problem in movement, affecting specifically the voluntary muscle action in the body. And ultimately resulting in either a minor form of weakness, that is, minor form of voluntary loss or voluntary muscle loss or voluntary muscle action loss, or movement disturbances, from weakness, just weakness, to complete physical collapse due to complete loss of control over the voluntary muscles of the body. So this is the what characterizes the three conditions and what is common among the three conditions. There is some loss of voluntary muscle action and movement. But the cataplexy is different from sleep paralysis and different from also the catatonia. From the causes, that is, what causes these three important clinical problems, and from the regarding the state of consciousness, and regarding the clinical cause or the clinical circumstances in which these medical conditions arise or they present clinically. In the cataplexy, there is what we call loss of the muscle tone. There is loss of muscle tone in the cataplexy. I will start with what is cataplexy. There is some disturbance in the muscle tone as a result of some severe emotions or intense emotions, causing some problem or some loss of the muscle tone, which is sudden and brief loss of muscle tone. Sudden and brief loss of muscle tone, resulting in either weakness, which might present, for example, at the level of the knees, with buckling of the knees, or loss of muscle tone in other parts of the body, and this is up to the occurrence of complete physical collapse, that is, inability to control the voluntary muscle action and the muscle tone, with resulting collapse of the body due to loss of muscle tone, voluntary muscles, that is mainly the skeletal muscles of the body, and the whole body collapse to the ground, that is physical collapse. This is usually this happens in the context of intense emotions, like due to severe surprise or frightening or anger or fear. These forms of emotional disturbances, again, in severe surprise or severe anger or severe fear. These intense emotions might cause some sort of sudden brief loss of muscle tone, resulting in either just weakness affecting some muscles of some part of the body, and will affect the musculoskeletal function of that part in the limb or in the trunk or in the whole body, up to complete physical collapse. And the result regarding the state of consciousness in this condition, which is cataplexy, the patient is awake, the patient is aware, totally awake and totally aware. And it can occur at any point or at any time of the day. It can occur in the night, in the afternoon, or in the daytime, and it can happen at any time of the day, as I mentioned. The cataplexy, it's usually the core symptom of narcolepsy type 1. It is the core symptom of narcolepsy. So cataplexy, which is sudden brief loss of muscle tone, as I mentioned, resulting in just weakness up to complete physical collapse. It is the core symptom of narcolepsy. Then I come to the what we call sleep paralysis. Sleep paralysis, this is complete loss of muscle movement or movement and speech. The patient is unable to move, or the person is unable to move or to talk for a short time, usually happening at the edges of the sleep. That is, at the time of the patient's about to fall asleep, or more commonly when the patient gets up from sleep. And it usually occurs in the time between full wakefulness and what we call the rapid eye movement or the dreamy part of sleep, or the rapid eye movement sleep. So it occurs in this period between complete wakefulness and REM sleep. When the person is still in this phase, in this part of the wakefulness state, he is not completely awake, and he is didn't yet get up from sleep. We call this sleep paralysis, because there is paralysis, as I mentioned, at the edges of sleep, when the patient is just about to fall asleep, that is at the beginning of sleep, or more commonly when the patient gets up from sleep, as I mentioned, between full wakefulness and the dreamy rapid eye movement sleep. And the patient is, as I mentioned, is here a little bit awake or aware, but not fully awake. Is not fully awake, is not fully aware. So he's unable to move or to speak, but he started to regain consciousness from the unconscious phase or the unconscious state of sleep. So here there is also the patient is awake but not fully awake, as I mentioned, and is not fully aware. And he's just unable to control his voluntary muscle action, and so is unable to move and is unable even to speak. He can't speak when he is in this sleep paralysis phase. And it's usually associated with what we call vivid hallucinations, usually or commonly associated with frightening vivid hallucinations during this time, or associated with this phenomenon of sleep paralysis, what we call sleep paralysis. And this sleep paralysis also, it can occur normally, as I mentioned. It happens in normal people, but especially common in patients who are under stress, or patients who didn't get enough sleep. That is, those who are having some sort of sleep disorder, they are more liable and they are more at risk to get this phenomenon of, or this medical condition, which we call it the sleep paralysis. So it's more common in stressed patients or stressed people, and patients who are not having enough sleep or didn't get enough sleep. They get this sleep paralysis. And it is a symptom also of narcolepsy. It can be a symptom of narcolepsy. Although it happens also, as I mentioned, as a normal phenomenon in normal persons, it's not a disease by itself, and it can happen in some people who are under stress or who didn't get enough sleep. They have this or they get this phenomenon of sleep paralysis. Sleep paralysis. Then the third condition, which is also characterized by some loss of voluntary muscle action and movement, is the catatonia. And the catatonia, it is a state also of problem in movement associated with some sort of rigidity, muscle rigidity, and some specific posture in the body. So it is a loss of voluntary muscle action with some sort of rigidity and abnormal posture. And this condition is usually a neuropsychiatric condition, and it's associated with psychiatric problems and other neurological disorders. And it is a motor phenomenon. And it is usually associated with other medical conditions. And the patient is aware and awake. But sometimes, in some cases, there is problem with wakefulness and problems with awareness. And they are commonly associated with, for example, psychiatric conditions, especially in schizophrenic patients, what we call catatonic schizophrenia. This is a subtype of schizophrenia. So, the catatonic schizophrenia. So it is some sort of schizophrenia, which is, as we all know, psychiatric condition, a psychotic condition, classified as a psychiatric condition, classified as psychosis or psychotic state, associated mainly with problem of thinking or disorder of thinking or disordered thinking, in addition to maybe disturbances in emotions also and in affect in many persons. So catatonia is part of a subtype of schizophrenia, which we call it catatonic schizophrenia. It can also be associated with major depression, and it can also be associated with bipolar disorders, which is also functional or organic psychotic conditions. So the catatonia, it is associated with, it's also, there is loss of muscle voluntary muscle action and movement, with associated with acquisition of a certain posture and with rigidity of a group of muscles, which may be localized or more diffuse in the body. And it is usually a neuropsychiatric condition or associated with psychiatric disorder, and as I mentioned, with motor problems, because there is muscle rigidity as a part of the clinical presentation or the clinical symptoms of catatonia. So this is catatonia. As I mentioned, also it is sometimes associated with unawareness, or the patient looks unawake or unaware, and it is usually associated, as I mentioned, with, it's never normal. It is there is some pathology or some neurological pathology, or maybe associated with other medical conditions, also maybe in some disturbances of the some organs, like it can be associated with liver cell failure, or in part of uremia due to encephalopathy. So the metabolic encephalopathy associated with organ failure inside the human body, especially in patients with liver cell failure, or even patients with renal failure, that's uremic patients. So in cholemic patients who are having liver failure, or uremic patients who are having renal failure, there is what we call metabolic encephalopathy. Part of the metabolic encephalopathy may be some sort or some picture of catatonia also. So catatonic neurological disorder, or this catatonic state, can be due to psychiatric or neurological or other systemic medical problems in the body. So this is, in short, the main differences between cataplexy, sleep paralysis, and catatonia. And they are, as I mentioned, they might be part of narcolepsy, especially the cataplexy and the sleep paralysis, as I mentioned. Cataplexy being the core symptom of narcolepsy type 1, and sleep paralysis, which may be also an essential symptom of narcolepsy in some people, although it can happen also, as I mentioned, in normal people who are under stress or who didn't get enough sleep. These are the differences between cataplexy and sleep paralysis and narcolepsy and catatonia. This is very important to remember in clinical practice, because we might be confronted with such clinical neurological conditions. Thank you so much, Professor Dr. Tarek Ali.